Hello friends, welcome back to Complete Medical Coding. Today let's discuss few guidelines and practice questions from anesthesia. Okay, even though anesthesia is easy to score marks, but still there are few guidelines that you need to be careful. You need to be that you need to understand. Okay. Anyway, moving to the questions. Friends, if you are new to the channel, please subscribe. Moving to the questions. Moving to first question. Dr. Momo performed a transesophageal echocardiography for a congenital cardiac condition in a 16-year-old patient. Prior to the probe placement, moderate conscious sedation was administered. The probe was placed, images occurred, interpretation and reports were completed in the provider's office. This procedure lasted 45 minutes. What codes capture the services performed by Dr. Momo? Okay. So here you have to code the services captured by or performed by Dr. Momo. So he has performed, what does he perform? Transesophageal echocardiography. Okay, transesophageal echocardiography with a moderate sedation, under a moderate conscious sedation. Okay, so anyway, let's go to the options one by one. What is the first option? The first code is 93315. So what is 93315? Let's go and take 93315. Transesophageal echocardiography. The short form is TEE. You might get it as TEE also. Okay, transesophageal echocardiography. Okay. So, all right. So, what is the first code? 93315. It's in the medicine chapter, right? 933 course is in the medicine chapter. So, if you take 93315, what is the procedure? Yes, transesophageal echocardiography for congenital cardiac anomalies. Same, including probe placement, image acquisition, interpretation, and report. So, probe placement is mentioned, image acquisition, interpretation, report, everything is mentioned. So, this is the exact code as per the question. Okay, so as per the question, this is the exact code for TEE for a congenital cardiac patient. Then probe placement is there. Then what else? Imaging guidance, images activated, that's also mentioned. Interpretation reports were completed. So everything is there in this code. Now what is the second one? 99152. So let's find out what is 99152. So it's also in the same medicine chapter. That is a moderate sedation service code. Moderate sedation service code. Okay. So 99152 is moderate sedation services provided by the same physician or other qualified healthcare professional performing the diagnostic or therapeutic service, etc. etc. It's mentioned. Okay. 152 is initial 15 minutes of intra-service time, patient 5 years or older. So here it's a 16-year-old patient. So yes, this is the code 99152 is also required. The initial 15 minutes. So 99152 is the moderate sedation which is given for initial 15 minutes. But in our question, how many minutes is there? This procedure lasted 45 minutes. So it means, see, why the anesthesia is being carried out, or why the anesthesia, or how long usually anesthesia is given. It's not mentioned here that the anesthesia, the patient is under anesthesia for 45 minutes. It's not mentioned like that, but it's just mentioned this procedure lasted 45 minutes. So, of course, the anesthesia will also be there until the procedure lasts, right? So, according to the procedure only, the doctor is giving out the anesthesia, whether it is moderate sedation, what do you call it, local anesthesia, general anesthesia, whatever it is. So, here this procedure has lasted 45 minutes. So, it means the anesthesia is also, the sedation time is also 45 minutes or more. Anyway, we have to code for 45 minutes. Okay, so 99152 is the code for the initial 15 minutes of sedation, moderate sedation. Now you have to code for the each additional 15 minutes, which is in 99153. The next code 99153. Each additional 15 minutes of intra-service time. List separately in addition to the primary procedure. Yes, so 99153 is each additional 15 minutes. So initial 15 minutes is 99152. So when you calculate the time 45 minutes, again 30 minutes more is there, right? So 99153 is for each additional 15 minutes. Each additional 15 minutes. So it means since our remaining time is 30 minutes, you have to code it twice. 99153 should be 2 times. Okay. Hope you understood how to get the codes. So what will be the answer in our options? As mentioned, option A, all the 3 codes are correct, but 99153 should be 2 times, which is in option C. So our correct answer is option C. Okay. 93315, 99152 and 99153 times 2. If you check option B, instead of 93315, which is the code for transesophageal echocardiography, they have mentioned some anesthesia code 00320, which is not correct because you have to code for the services performed, all the services performed. So, of course, you have to code for the transesophageal echocardiography code, TEE code. So, as I told you, C is the correct answer. Alright. Moving to the second question. Kathy is a 77-year-old patient with a severe hypertensive disease. She underwent a cataract surgery to both eyes under general anesthesia. Dr. Sharon, the anesthesiologist, performed the anesthesia. Prior to induction of anesthesia, Dr. Sharon completed a pre-operative visit and documented a detailed history, detailed examination, and low complexity decision making on this new patient. How would you report Dr. Sharon's services? So here you have to code for Dr. Sharon's services. What is she carried out? She is the anesthesiologist. So before induction of anesthesia, she performed some E&M service, some office visit. Right? So, what anesthesia is given? It's general anesthesia is being carried out here. Okay. You cannot say that it's an E&M visit because see here it is mentioned Dr. Sharon completed a pre-operative visit. It's just a pre-operative visit. It's not an office visit. Okay. And documented a detailed history, detailed examination and low complexity decision making. So while seeing this sentence, you might be confused that we should add E&M code. See, as given in option A, 99203, which is the E&M code. But this is, and see, to make you confused, the question is like that. Detailed history, detailed examination, low complexity. MDM is of low complexity on this new patient, that is also mentioned. To make you confused as, oh, okay, so we have to code for the E&M for this new patient. No, it's not like that. Okay. Here, this is not an office visit, but this is a pre-operative visit by the anesthesiologist. So it is from an anesthesiologist. Anesthesiologists never do an office visit. You cannot build an office visit or E&M code for anesthesiologist. Okay, because anesthesiologist is only, they will see the patient only during a pre-operative visit. So you can't code E&M service here. So you can directly skip option A. Alright. Now let's go to the remaining 3 options. In the second option, 66820. Let's find out what is 66820. Okay. What is 66820? 66820 is, it comes under I chapter I. Okay, decision of secondary membrane is cataract. Stab incision technique. Something about incision, incision. So stab incision technique for the cataract. What is here performed? She underwent a cataract surgery to both eyes. It doesn't mention about any incision or that is not carried out. This option is wrong. Okay, because here you have to code for Dr. Sharon's services, who is the anesthesiologist. So you should not code 66820 or you should not code the procedure from other chapters. Okay. So option B is wrong. Now if you see option C, what is 00140? The anesthesia code 00. Let's find out the anesthesia code anyway. 0015. Only we have two options remaining now. 00140 and 00142, which is correct. Let's find out. 00140. What is 00140? Anesthesia for procedures on eye, not otherwise specified. And 00142 is anesthesia for procedures on eye, lens surgery. Yes, this is cataract surgery, which means surgery related to the lens removal, right? I mean removal and replacement. Yes, so cataract surgery, anesthesia. So it means you have to code for the lens surgery code, which is 00142. So option C is wrong. You directly got the answer as option D, 00142, because 00142 is only in option D. And see why it is marked with P3 qualifying, physical status modifier, P3, P1, P2, P3, P4, P5, P6, P1 to P6 represents the physical status modifiers. What does P3 represents? A patient with severe systemic disease. Yes, it is clearly mentioned in the question on the first sentence that this patient is a severe hypertensive disease. So 00142 should be marked with, for anesthesia you have to mark always some modifiers. P3. Okay, and what does 99100 represents? That's the qualifying circumstances, 99100. Anesthesia for patient of extreme age, younger than 1 year and older than 70. Yes, so those patients who is younger than 1 year or older than 70, you have to code anesthesia 99100 to mark it as a extreme age patient. So this is, since it is 77-year-old patient, you have to code it as, you have to code the qualifying circumstances code also. So 99100. So that's how you have to find out the code. So here the answer is option D, 00142. Mark it with the modifier P3, physical status modifier, and then add qualifying circumstances also 99100 to make sure that this patient anesthesia for this patient is extreme age patient. Okay, anesthesia is being given to an extreme age patient. Yes. Now moving to the third question. A patient is having knee replacement surgery. The surgeon requests that in addition to the general anesthesia for the procedure, that the anesthesiologist also insert a lumbar epidural for postoperative pain management. The anesthesiologist performs postoperative management for 2 postoperative days for this procedure. So 2 postoperative days, pain management code. The patient was having knee replacement surgery. So in addition to the general anesthesia, the anesthesiologist performs the epidural, lumbar epidural. Okay. So let's find out the anesthesia code first. See, if you check the options, 01400 or 01402, which is the right one? 01400. Let's take what is 01400. 01400 is anesthesia for open or surgical arthroscopic procedures on knee joint, not otherwise specified. 01402 is total knee arthroplasty. Yes, we have, it's not otherwise specified. We have the clear picture given in the question, that is the knee replacement surgery. So our exact anesthesia code should be 01402. Okay, because it's a anesthesia for open surgical arthroscopic procedures on knee joint for total knee arthroplasty. So 01402 is our exact anesthesia code. So you can skip the other 2 options. You can only go for 01402 code. Okay, and it is being marked with modifier AA. AA modifier, you can check. You will be if you check AA modifier, what does it mean? AA modifier means it is the service is performed directly by the anesthesiologist. That is why that code, that modifier is marked. AA modifier, it represents the anesthesia services are performed personally by the anesthesiologist. They didn't appoint some other CRNA or somebody, no. Okay, 01402 should be appended with the modifier AA. Now, if you check in option B, what is 01996? Do we need that code 01996? Just check that. Of course, it is required because in options B and C that code is there. So you can, okay, you can check it out. But still, if you want to save time for the examination, if you need to save time, you can just skip that code and then go for the other code which is in option C. Anyway, this code is required because it is there in both the options. Still, I will let's check what it is. 01996. 01996 is 01996 is daily hospital management of epidural or subarachnoid continuous drug administration. Yeah, epidural code it is. And it is marked twice because 2 postoperative days. The patient has come for 2 postoperative days, so mark it with 2. Anyway, that is there in both options B and C. Now we have one more option, one more code remaining in option C, 62326. Let's see what is 62326. You should not directly skip it. You should check what it is. Sometimes that procedure is also required. See, here our question is code this procedure. Here in our question, it didn't mention that didn't mention about code only the anesthesiologist. No, we have to code the procedure, whole procedure. So you have to code for both the surgeon service as well as anesthesiologist. So if you see 62326 code, what is 62326? Injection. Okay, injection including indwelling catheter placement, continuous infusion or intermittent bolus of diagnostic or therapeutic substances, example anesthetic, antispasmodic, opioid, steroid or other solution, not including neurolytic substances, without imaging guidance. Lumbar or sacral caudal. Yeah, the injection procedure, the epidural, which is the injection procedure, right? Then yeah, lumbar epidural for postoperative pain management. So injection procedure is also required here. Injection including catheter placement, continuous infusion. That is why it is mentioned in the question that in addition to the general, the surgeon requests that in addition to the general anesthesia, the anesthesiologist also inserted a lumbar epidural, which means an additional injection procedure carried out. So 62326 is required here. So the correct answer is option C, not B. Don't be confused with options B and C. You read the question carefully. Check out the options again one by one. Okay, you will understand it. So mark option C as the correct answer. 01402, modifier AA, 62326 for the epidural injection procedure, and 01996 for the postoperative management, the epidural and everything, the postoperative management, which has been done for 2 postoperative days. So times 2. Okay, hope you understood. Moving to the fourth question. This is an important question because it represents the anesthesia time. A healthy 45-year-old is having a needle thyroid biopsy. The anesthesiologist begins to prepare the patient for surgery at 9 a.m. The surgery begins at 9:15 a.m. and ends at 9:45 a.m. The anesthesiologist turns over the care of the patient to the recovery room nurse at 10 a.m. What is appropriate anesthesia code and what is anesthesia time? So here you have to code the appropriate anesthesia code as well as anesthesia time. So moving to the options, if you check the option, see only 2 codes are there. Let's find out the code anyway, the anesthesia code first. Then I'll tell you the guideline for how to calculate the anesthesia time. Okay. So what is the anesthesia code? 00320. It should be either 00320 or 00322. What is 00320? Anesthesia for all procedures on esophagus, thyroid, larynx, trachea, and lymphatic, age 1 year or older. And what is 00322? Needle biopsy of thyroid. Is it mentioned in the question that it is a needle biopsy of thyroid? Yes. First sentence. A healthy 45-year-old patient is having a needle thyroid biopsy. So, since it is accurately, it's correctly marked as needle thyroid biopsy, you have to go for code 00322. The anesthesia code 00322. Okay, that's the code for anesthesia for a needle biopsy thyroid. So skip options A and B. So you got the correct anesthesia code as 00322. Now you have to find the time. How to calculate the time of anesthesia. That's an important guideline. You will definitely get a question from anesthesia to calculate the anesthesia time. Okay. So the anesthesia time usually calculates, not usually, every time. Anesthesia time calculates from the time the patient is preparing for surgery, to prepare the patient for surgery. That is the starting time of anesthesia. Once the patient is prepared for the surgery. Okay, here it is 9 a.m. And the ending time of anesthesia is the patient has sent to recovery. Till the patient is being sent to recovery, not the procedure ending time. Here the procedure ending time is 9:45. That is why, to make you confused, they have given in options 45 minutes in one option and 1 hour in one option. So if you check anesthesia time, beginning time, patient prepared for the surgery, prepared for anesthesia, that is at 9 a.m. Surgery begins 9:15, ends at 9:45. Don't think that surgery has started 9:15 and ends at 9:45, so that is the anesthesia time. No, that's wrong. Also, don't think that anesthesia is given at 9 a.m. and then surgery finished at 9:45. So anesthesia also finished. No, that is wrong. So 45 minutes is the wrong code, wrong answer. You have to always check the anesthesia time as till the patient has been sent to the recovery room, which is 10 a.m. here. So the correct anesthesia time here is 1 hour. Okay, hope you understood how the anesthesia time is being calculated. So anesthesia time, I'll repeat it again, anesthesia time is being calculated. The starting time of anesthesia is the time when the patient is being prepared for anesthesia. And then the ending time of anesthesia is till the patient has been sent to the recovery. Of course, they will give you the time. If you get such type of questions, they will be mentioning you the time in the question, in the documentation. Okay. So here the correct answer is option D, 00322, which represents the anesthesia. Okay. Having a needle thyroid biopsy, and then the anesthesia time 1 hour. The starting time 9 a.m., ending time recovery 10 a.m. So the total time 1 hour. Okay, B is the correct answer. Moving to fifth question. Patient is admitted in labor for delivery. She received a labor neuraxial epidural for a vaginal delivery. The baby goes into fetal distress and a cesarean section is performed. Following delivery, the patient starts to hemorrhage. The physician decides, with family approval, to perform a hysterectomy. Code the anesthesia services. So here they have asked, they have not, in the question it is not about to code the procedure, but only to code the anesthesia services. So only anesthesia part we have to check. Okay. Alright, going to first option. 01967, the first code. 01967. What is 01967? Neuraxial labor, analgesia or anesthesia for planned vaginal delivery. Yes, in the question it was, the patient is in the labor for delivery. So it was a labor neuraxial epidural. See, she received a labor neuraxial epidural for a vaginal delivery. So it was a planned vaginal delivery. So 01967 code should be there. Okay, neuraxial labor anesthesia for planned vaginal delivery. This includes any repeat subarachnoid needle placement and drug injection or any necessary replacement of any epidural catheter during labor. Yes, 01967 should be there. What is the second code? In option A, 00840. What is 00840? 00840 is anesthesia for intraperitoneal procedures in lower abdomen, including laparoscopy. No, there is nothing mentioned in our question about laparoscopy. Later they performed a cesarean section, or later they performed hysterectomy. So there is nothing about laparoscopy, nothing. That is a wrong code, 00840. Okay. Now, if you check option B, so option A is wrong. If you check option B, 01968. Again, what is 01968? It is wrong code because see, if you check the CPT code book, 01968 is an add-on code. So you can't code only add-on code alone. So it is wrong. Just skip it out. 01962, option C. 01962 is anesthesia for urgent hysterectomy following delivery. 01962 could be the answer, but let's check the other option also because 01962 means anesthesia for urgent hysterectomy following delivery. Yes, this hysterectomy is done following a delivery. But just wait. Move to option D. What is 0196? 01967? Same, we already checked. And what is 01969? Anesthesia for cesarean hysterectomy following neuraxial labor anesthesia. Yes, this is the exact code that we need, right? Because initially for the planned vaginal delivery, an epidural was given. And then later, they did a cesarean delivery. Of course, for the cesarean, they'll put anesthesia again. So, following the cesarean, they did hysterectomy. So, for cesarean and hysterectomy, both another anesthesia, even though it is not mentioned, it is understood that for cesarean delivery, they will give anesthesia, right? So, 01969 also should be coded. So, here the correct answer is option D, 01967 for the normal delivery epidural and 01969 for the other procedure, for the cesarean delivery plus hysterectomy procedure. Okay, so that's it. So friends, that's it for today. Hope you understood. Anesthesia is very easy to learn and very easy to score marks. But be careful. Read each and every topic. Read each and every term which is related to the question. Read each and every term in the CPT, also in the code also. Okay. So hope you understood. And if you have any queries, friends, please mark it in the comments and I'll be getting back to you soon. And thank you so much. Those who are new to the channel, please subscribe and please share my videos. Please share this video. If you find this video useful, please like and share to your friends. Thank you so much and stay tuned. Bye. Take care. See you in the next episode. Bye.